The meeting of the Board of Ellis County Commissioners will now come to order. Let's stand for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hey, Bobby, if you want to call the roll.
Commissioner Dean Hazelhorst.
Present.
Commissioner Chair Butch Schleier.
Present.
Commissioner Neil Younger.
Present.
We have a quorum.
Okay, thank you. Order of business, I don't think there's any changes or any additions. We will have 2 executive sessions this evening. Prior minutes. Commissioners, did you review the prior minutes?
Everything looked good.
Did a good
Okay.
job.
Then the minutes will stand as submitted. Do I hear a motion for the consent agenda?
It's your turn.
I make a motion for the consent agenda, items A through G.
Second that.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Any issues from persons not on the order of business? See any hands going up, so. Okay, then the next agenda item is High Plains Mental Health Annual Report. Walt.
Seems like it's been forever since we've seen Walt here.
I just come sometimes for the entertainment value.
Entertainment is good.
And I'll be back next week. Hat in hand. So, this is, I'm Walt Hill. I'm the Executive Director at High Plains Mental Health Center. Appreciate the time this evening. This is the first of 2 meetings we have with you. This is an annual report on behalf of High Plains to you as one of the 20 counties that comprise the interlocal agreement that sets up High Plains. Some agencies that you fund through contractual arrangements. High Plains, you have established us through that interlocal agreement, and we're technically what's called a quasi-municipality because we're an arm of county government. It's a bit of an unusual designation. We're, for example, audited as a under county audit principles, and there are 3 ways in Kansas mental health centers are set up: independent nonprofit corporations, like we are, county departments. So that interlocal agreement calls for us to meet annually, provide a report. Of course, I will be here anytime you want me to give you any updates on any issues. But this is a formal report based on that, our agreement with the counties. This is the last of the 20 county meetings we've had. All of them have been very positive. Talked a lot about the impact of COVID on us and our communities. It has been a bit of a challenge. There were some months where we were a little concerned, like last July, where our finances were, we were nearly $500,000 in the red. Things were very slow. What was most important to us was continuing to get people the services that they needed. That was a challenge because we'd sent staff home. They were working from their homes. We had very few staff in the office, but all of our counselors, therapists, case managers worked from home. We had just begun to bring on board a number of iPads, and we quickly increased those just before the big hit from COVID. So people worked from home. They had computers that could access the electronic records of patients, and I handed out a chart that we just finished that showed the number of patients we saw each month during COVID, which showed it. That was my big concern, that we have a drop-off. People didn't get services when they needed it, and the data suggested people still got the services. We went from like 15% of services prior to COVID being by virtual telemedicine up to, at several points, 95, 96% of patients were served through telemedicine, and that was pretty effective. We even were concerned that it met people's needs. So we contacted 800 of our patients that we delivered telemedicine service to and asked them a survey, a sample. Did this work for you? Did you get what you needed? Would you want to continue doing this? A third of people said, I'd rather just keep being seen this way forever, not have to come into the office. A third said, either way is fine, I get what I need. And a third said, I want to come back to the office as soon as I can. So it's really becoming an accepted model across the country to do a hybrid service, to deliver services. Whether the payers will go along with that, we will see. But it works in terms of patient satisfaction and getting services out the door. We have all of our staff back in the office now, effective the 1st of April. And services continue to be, solid. We saw some increase in crisis services during COVID. I think most people did across the mental health system. In your packet is a report specifically for Ellis County that has the red graph at the top. This shows in 2020, we saw approximately another 92 Ellis County citizens prior to what we saw in 2019. We have a couple of offices in unique situations here in Ellis County. We go into the Ellis County Health Department and see patients there. We rent space there to see patients who come in there, and we saw 35 patients there. 14 of those were new to us, so they are able to get in, not have to come into our office. They're already in the health department office and come in there to get started and get their services. And then we have office that we rent at Hayes Family Medicine. And we saw 95 patients there last year. 79 of those were new patients to us. So we were able to offer pretty easy access. If a patient went in to, at that time, see, say, Dr. Rajeski, and he thought they needed to come in and see us, they could send them just down the hall and we would get them opened. And it's a really popular model. I think we'll continue to expand that. So in 2020, we delivered $4.6 million in patient services to Ellis County citizens. That is to about a third of the total patients we see are from Ellis County. About 2/3 of our payroll is to Ellis County residents, and that payroll is $4.1 million, or about 70% of our payroll goes to residents of Ellis County, because we have the centralized services here, and though we have branch offices, Goodland, Colby, Norton, Phillipsburg, and Osborne, and each county we have an outreach office 1 day a week at least, usually in a doctor's office. So your say $275,000, $280,000 county funding support allowed us to deliver over $4.5 million in services to Ellis County citizens. Many of those have lower incomes. 52% of the patients from Ellis County that we saw that year had family incomes under $25,000. So we use county funds to help provide a subsidy so that patients don't have to pay the full cost of services. We have services based on a sliding fee contingent upon their income level. We make up the rest with insurance payments, state grants, and some state funding. There is a center-wide report that shows overall we could have seen more patients, again, across the entire 20 counties. In addition to the patients that we see here in Ellis County, be that by our psychiatrists, our nurse practitioners, our therapists, we also provide services that aren't patients necessarily. Crisis services when law enforcement or emergency workers deal with a crisis situations. We do that across the 20 counties. If there's a difficult situation that EMS or law enforcement runs into with a bad accident, a suicide, we have teams of people that will go out and help debrief those emergency responders if we're requested. We also provide a significant amount of what's called mental health first aid, which is about a one-day training for anyone, EMS, teachers, anyone in the community, of how to deal with someone who's having a mental health crisis. What this does is helps people feel more comfortable if someone they know says something, which often we're uncomfortable. I am still. If someone says X, Y, or Z, I feel like hurting myself. I feel so depressed. A lot of times we don't know what to say. This training basically helps people learn how to deal with that and how to get the person to help, just like with regular first aid or CPR. And over 90% of people who take that class, which has been over 1,300, 3,000 people across the 20 counties, 90% or more say after the class they feel more comfortable in helping someone get to services, or in fact they helped someone get to services. So that's a service we provide basically free of charge at the request of whoever in the area wants. One of the challenges that I do want to mention, and I think I've related this last year, is the challenges with inpatient psychiatric care availability. Larned State Hospital has reduced the number of beds available, so we have situations where they are not taking admissions, and patients who law enforcement bring into the emergency department or deal with in their jails throughout our area, including here, are holding these patients in, they're basically being boarded in emergency rooms pending admission to Larned State Hospital for sometimes 2-3 days. It's a major issue for law enforcement. It's a major issue for Hayes Med. We've been in communication with state legislators about this issue. We're setting up a meeting before the end of the month to bring them out, people from KDADS who have responsibility for the state hospitals, and to ask questions. When are those beds going to return? The same for the kids' psychiatric inpatient beds that were here in Hayes, that were closed. Last legislative session, Representative Billinger, or Senator Billinger, forwarded a bill to put $1 million in to reopen that kids' psychiatric unit here in Hayes. That was last session, not the most immediate session, a year ago. It's not happened yet. So we will be bringing people together to ask the state what's the holdup, because we have parents who have kids who need to go to the hospital for psychiatric reason, who say, I just can't take my kid down to Wichita and spend a week or more with them while they're there, and they don't admit kids. We have that pretty frequently at Westside School. Kids get really out of hand, really depressed. They do need to go to the hospital, but that's just a long haul to take a kid to Kansas City or Wichita for hospitalization. So we've pushed that hard, worked with Senator Billinger to get that restored. Now they just need to open those beds. So I know it's an issue for the sheriff here in town. It's for the police chief here in town, in all 20 counties. I just want to make you aware of that it's a real drain on resources, that it's not a drain. It needs to happen. You got to keep people safe, but they really need to be in a better setting, a more appropriate setting for treatment, not waiting in a jail or an emergency room for 2 or 3 days. The good news potentially is some major increase in funding from the federal government for something called Certified Community Behavioral Health Centers. This is a new designation for mental health centers that sets a higher bar for services, more services out to people in emergencies in the community, services to veterans, services to schools, faster access. This is moving across the country with developing these, with the funding to do that. We just, in March, 1st of March, finished a $2 million 2-year grant to establish those services with federal funding, so $4 million coming here. And then we haven't heard yet about that. The good news is we're working with the state very positively to establish a way that Medicaid will sustain those services with cost-based reimbursement, similar to what they do with rural hospitals and the FQHC, to reimburse us for the cost of service, not just fee for service. And then we just applied for another federal grant for $1.5 million twice for over 2 years to even add on to that. So we potentially have $7 million coming into the community over the next 2.5 years to increase service level, increase number of staff by 20, and have the funding to support that without drawing on federal or on local resources, using federal funds and then sustaining that over time with Medicaid. It's a pretty big deal, and I told one of the heads of our National Association of Mental Health Centers, I'm kind of an old curmudgeon. I've been around about 40 years. I don't get excited about much, except this is one of the most exciting things I've ever seen in my career in mental health. To finally see mental health being recognized and by the federal government, and finally, since middle 1950s, putting federal dollars into community mental health centers to deliver services. So it is an exciting time. So I'll stop there. Be glad to answer any questions. Again,